Hi, I'm Dr. Sarah Hurvitz from the University of California, Los Angeles. Neratinib is a pill that blocks the HER2 receptor. Most of our therapies or our early therapies that target HER2 block the outside of the receptor, the extracellular domain. Neratinib is a small molecule, a chemical compound given as a pill that actually gets inside the cancer cell and blocks HER2 on the intracellular portion of the receptor. It also blocks other receptors in the HER family. One of those is called HER1 or epidermal growth factor receptor, EGFR. By blocking EGFR in addition to HER2, there are additional side effects experienced by patients taking neratinib. EGFR is expressed on our skin and on our gut. And so when we block that receptor, we can have issues such as rash, as well as diarrhea and other GI side effects like nausea and vomiting. With neratinib as a single agent, which is how it's approved for patients with early stage HER2 positive breast cancer, about a quarter of women will develop moderate to severe diarrhea, meaning diarrhea that is occurring on the order of 6 or 7 bowel movements more than a patient experiences normally on a day to day basis. It can be quite severe and in some cases leads to hospitalization or the need for IV hydration. Because of this, neratinib must be given with an antidiarrheal medicine such as Imodium or Lamodal, beginning with the very first dose of neratinib and continuing for at least a cycle or two. The antidiarrheals can be tapered off if a patient is experiencing constipation or doesn't experience diarrhea. But it's critical that a patient works really closely with her physician or her oncology nurse to make sure that this side effect is being monitored closely and followed closely. Um, there are some studies that indicate if you start at a lower dose of neratinib for the first week and then slowly escalate over the course of the first month up to the target dose, that may reduce the risk of diarrhea. Other medicines that might be used include cholesterol and budesonide. Those may also help deal with diarrhea. So it takes a close working relationship between patient and physician or patient and nurse, especially in the first few months of taking neratinib. Rash, which also can occur and be bothersome to patients, can be managed by topical antibiotics such as clindamycin and other drying agents. Patients should be careful of sun exposure and also careful of perfumes and other cosmetic products that can exacerbate the rash. And other side effects such as nausea and vomiting and fatigue also are generally not severe, should be talked, but the patient should be talking to their physician if they are experiencing any of these types of side effects.